A very good morning to one and all present here. I, Miss Ishika Korbat,
And I, Sharon Nixon Samuel,
students of BSc Nursing, Symbiosis College of Nursing, Symbiosis International University, welcomes you to Day 2, first session of SYMHEALTH 2022. We are your host for this interesting session named as What Ails Are Nightingales. Nurses are the backbone of healthcare delivery system. The nursing profession began to expand beyond hospital walls as technology and industrialization progressed. The ongoing issues in nursing are scarcity of nurses, understaffing, heavy workload. Nurses aren't all tech savvy. They have to stay updated with all the advanced technology. Dealing with new software equipment on top of an heavy schedule can be overwhelming. Nurses make a difference in each life they touch. It's critical to be aware of today's nursing concerns in order to avoid burnouts. Future of healthcare belongs to nurses as there is unequal proportion of demand and supply of nurses. Our training programs should be held in such a way that challenges will be resolved and nurses will be prepared for high quality care, dedicated and fulfilling the needs of society by and large.
I am honored to introduce our first speaker of the day, Dr. T. Dileep Kumar, President of Indian Nursing Council, who is also the former project director of GF-ATM program, former nursing advisor to the Government of India. Sir has long-standing 43 years of experience in nursing and has worked in various capacities like staff nurse, nursing tutor, nursing superintendent, and deputy nursing advisor. Sir was the first member of Global Advisory Committee of WHO and has contributed in increased allocation and in obtaining the global funding from GFATM to the INC. With his commendable efforts, India has joined a club of 140 countries and is being a member of International Council of Nurses. Sir is also recognized to sign MOU of BRICS National Nurses Alliance. As a president of Indian Nursing Council, Sir has initiated many reforms in functioning of INC and development of National Consortium for PhD in Nursing. May I now request Sir to kindly come up on the dais.
We acknowledge the presence of Dr. S.B. Mujumdar, sir. We welcome you, sir.
Respected Majumdar ji, distinguished faculty members, distinguished delegates who have come from different parts of the country, and my dear students and ladies and gentlemen. First of all, I would like to thank the organizers for remembering me to be part of this SYMHEALTH. Generally, with Dr. Rajiv ji, I had a lot of interactions, some of the issues and challenges what the nursing sector is facing. I always keep discussing, and at least the latest issue which I discussed with him is about the simulation. So I made him to come to Delhi, where we have developed the state-of-the-art simulation center in a public-private partnership. I think that is the one of the solution we are now thinking of how best to improve the quality of the nursing education, competency-based training program, where I think, good old days gone, where we used to go and touch the patient. And I always give the example for simulation. Whenever I went as a student nurse to the operation theater, my OT sister told me, don't touch. So the fear started for me. Whenever we go as a student to the ICU, so ICU sister बोलेगा भाई ये टच करो, टच मत करो, टेक्नोलॉजी है ये, कुछ खराब हो जाएगा. सो हमारा लिए फर्स्ट वहीं से शुरू हो जाता है फियर. आई थिंक थ्रू दिस सिमुलेशन वी हैव टू रिमूव द फियर. You have to play with these equipments just like a toys, so that they will be confident, competent, and at least know. I always say that patient safety is in the hands of the nurses. We are the custodians of the patient safety. And similarly, the pilot in the aircraft, he is a custodian of the passenger safety. And the pilot is first trained through the simulation. So therefore, I think in this technology, the simulation is having a very important role, especially in the healthcare industry. I think the title very rightly you people have identified. And about Nightingale, you all know globally the Florence Nightingale, who is the modern founder of the modern nursing globally. And this, in order to commemorate 200-year birth anniversary of the Florence Nightingale, the World Health Organization declared as the International Year of the Nurse and Midwife, which is a very big Lord Nigel Crisp, who has happened to be the ex-NHS secretary, who took the initiative of bringing this issue to the World Health Organization and the International Council for Nurses. The best tribute we can give to the Florence Nightingale, who has contributed so much for the healthcare industry. So the WHO took a policy decision of declaring 2020 as the International Year of the Nurse and Midwife. Unfortunately, we nursing professionals from the global or in India, we could not celebrate this euphoria what the World Health Organization and the International Council for Nurses gave to the nursing professionals globally due to the COVID-19. So immediately the nurses became more busy with the COVID-19. You all know how the nursing professionals contributed in taking care of, and at least the visibility of the nursing profession has improved after the COVID-19. I think World Health Organization, they did not, especially Lord Nigel Crisp, happened to be the NHS secretary. He was knowing how the nurses are contributing for the healthcare industry in UK. So he worked very hard to get the evidence globally. And WHO came out for the first time the status of the World Nursing Report, 2020, SON report they call. And the International Confederation of Midwives also, in 2021, they came out with the international, the State of the World Midwife report. These two global reports of the, are, at least for me, working in the government of India, it is a music to the ears to me. The way they have captured the issues and challenges in these two reports. The theme of these two reports are very much interesting for the healthcare industry. The theme of the reports are, the first theme is investment. Investment to the nursing. The second is creation of the positions. The third is leadership. The fourth is, the theme of the report are the investment. See, even the globe is interacting with many of the countries. They are finding the investment to the nursing sector is not coming. So that is one of the, I think, what ails for the Nightingales, I think, is coming out from these reports. The creation of the positions, the second theme which has been focused in these two reports are creation of the positions. The leadership, that it is lacking in the leadership and the service delivery. These are the four main themes which has been captured in these two reports. And World Health Assembly 2021, you all know that World Health Assembly every May it takes place in Geneva, represented by the 190 health ministers, 190 health secretaries, 190 director generals. Generally, they meet in the month of May in Geneva. They come out with they discuss the global health trends and come out with the recommendations in the form of the resolutions. After 10 years, the agenda of nursing came to the World Health Assembly. That itself shows how much time they have to spend to get the agenda to the global policy table. And that came as a 21, and these all the health ministers in the 2021, and that too that is on virtual, and they came out with a resolution called Strategic Direction for Nursing and Midwifery 21-25. World Health Assembly works in the form of 4-year cycle. So they have come out with these resolutions, and these resolutions are, as I said, now they have sent it to all the countries for the implementation. Next. As I said, these themes and also the recommendations, as I said, at least worked as a government of India as a nursing advisor, and where how much difficulty to getting the funding for the nursing sector, and at least reasonably the government of India is good for at least getting in the plan money, but at the state level you don't find many plan money for the nursing sector. I think hardly you will find a plan money, because always you get money for a salary, but a plan money for the hospital, for nursing sector is not coming. So that's what we have to make a differentiation. Many people, when we talk investment, is by itna nurses ko salary hum de rahe hai, paisa spend kar raha hai. No, that is not that. A plan money, that is a committed liability. We should make a differentiation between the plan money and the committed liability. So that plan money is not there. There is no growth for that, no innovations, no further developments, and you don't get even for the continuing education. Next. See, this whole what Nightingale ails, the title what you people have given to me, I think this the nursing contribution to patient safety, in these two slides, at least they have captured the evidence globally by the State of the World Nursing Report. The burnout among nurses and doctors due to high workload, long journeys, and ineffective interpersonal relationship has been associated with the worsening patient safety. So they have very clearly captured, this is very important component. Whereas the good work environment, safe staffing of nurses and education is mixed. Skilled teams are correlated with the reduced hospital length stay. If we are having a very good optimum nurse-patient ratio, many evidences has come, the length of the stay of the patient in the hospital will be reduced, so that the beds are very limited, so that you will be able to treat more patients. So therefore, the good optimum nurse-patient ratio, that's what in the theme what the report is telling is creation of the positions. We are not creating the positions. So with the result, you don't have a good working staffing norm. Then it also says the lower incidence of the adverse events such as pneumonia, gastritis, upper gastrointestinal bleeds, pressure ulcers, and catheter-associated urinary tract infection, and reduced overall mortality. So therefore, this the optimum nurse-patient ratio is going to make a much of a adverse events you can reduce if you have a good staffing norm. What ails Nightingales in India has been reflected effectively in the above nurses' contribution to the patient. So there is enough evidence, global evidence is available. If you have a good nursing staffing norm, you will be able to, your impacts and outcomes in the patient outcomes in the hospital, it will be very effective. The next. I think as the India, which is a big country, where we have in 1947 we had only about 150 institutions. So now we have a grown quantification of expansion in the nursing education has taken. Quality is a concern for us. The quantification expansion has taken. We have rightly now at present about 1,962 A&M schools. You know, these A&Ms are expected to work in the sub-center, which caters to a population of 5,000 in plain area and 3,000 in hill and tribal area. So these A&Ms who are trained are positioned at the sub-center level. Now under the Ayushman Bharat, the sub-center has been converted into health and wellness centers, and now the latest policy decision is to have this at the sub-center level, mid-level health providers. They are also called as a community health officers, are positioned there, and they have given a extra prescription, limited prescription, and the drugs are which are given at the sub-center level. They will be able to take care of the treatment of minor ailments. I remember some time back, 20 years back or 15 years back, when I came to Symbiosis, Dr. Majumdarji was making a point that in the rural area, these people has to be given empowered. I think this is what now you can see this, now the things are improving, that the community health officer who is a graduate in nursing, is a BSc nurse, and many, I think 70% of the states have adopted a qualified BSc nurse as a community health officer. In some states, they are taking as homeopathic doctor and other Ayurvedic doctors, but majority of the states have opted for the BSc nurse and seeing some good results, because a nurse, a BSc nurse has qualified and know the whole gamut of the healthcare sector in treatment of all the systems and also all the diseases, because this nurse has undergone, even she knows what is tetanus, she knows everything. So therefore, the opportunity is there in the BSc nursing to have all the issues and challenges with the health sector is facing. So therefore, in the A&M at the sub-center level, under the Ayushman Bharat, this is a new policy development, which is already they are seeing the impact now. And we have a diploma nursing schools. We have about 3,360 schools all over India with a capacity of 1.40 lakh is the capacity. BSc nurses, we have about 2,241. And MSc, I think when I did my MSc, only 6 MSc colleges were there in somewhere in 1980. I think now we have about 720 postgraduate institutions. So as I said, we have gone with a quantification of expansion. I am as a regulator, I am more cautious that we have gone with a quantification of expansion. A quality is a concern. We have a high-tech, highly qualified, where our nurses globally well sought, because our syllabus is covering in a qualitative the syllabus. That's why when I interact with the America or with the Irish people, they say, your syllabus is so excellent, a comprehensive healthcare you people are teaching. In other countries, a person is trained only for adult nursing, a person is trained for the pediatric nursing. So there is so much over specialization. With the result, our nurses having a comprehensive training, so that our curriculum is well appreciated overseas. So with the induction training, I am again making a qualification. Our own nurses, with the same type of training what we are giving, with the induction training, they are doing a marvelous job in the overseas. The good working environment is going to make a difference. If you are giving a staff inspection unit norm of one nurse has to look after the 4 patients, definitely she will be able to give a good care. Here you know that one nurse has to take care of 20 to 30 patients. So how she will be able to the quality care? So therefore, the quality now, the Government of India and the Indian Nursing Council, we are coming with a various propositions to improve the quality of the nursing education in India. Next. If you see the indicators, where are we? Where is the India standing? So this also gives you see for the density of the population versus nurses. In America, 145 nurses is there for 10,000 population, whereas India we are having a 17.3 nurses for 10,000 population. I am telling you, this 17 what I am quoting is also not a reliable data. Is not a reliable data. Like for example, if Maharashtra government gives the assembly replay in the assembly, how many nurses are there in Maharashtra? They will say X number of nurses are registered from 1947 to date. Even for the Parliament, Indian Nursing Council, not only for Nursing Council, all the medical council, all the regulators, we give this information, how many, out of the 1947 to date, how many people have died, how many people have gone abroad, how many people are sitting at home, all the data is there. So therefore, in my opinion, this is again is not a reliable data. So therefore, at least Indian Nursing Council is the only regulatory body which has come out with a nursing registration tracking system. We have collected 10 lakh nurses linked with the Aadhaar. We have a live data, literally census we have done, and in the 3 states we have to yet to do due to the COVID pandemic, they are going very slow. Within 6 months, we are going to freeze the data. That means a district collector, by putting that particular district name, and he or she will be able to come to know how many nurses are there in that district with their specialization, how many postgraduates, how many specialized nurses, all that nursing registration tracking system, which has now the ministry has adopted and is telling all other councils to do the similar type of a live register. See, any health manpower planning at the state level or the national level, if you don't have a reliable data, all our planning is going to be not going to be successful. So we are therefore a data. Now World Health Organization, I think now you people might be listening the word National Health Workforce Accounts. That is the new terminology. The WHO is asking all the countries to give a data of all the national health workforce accounts. First we thought, bhai ye accounts ka word kyun aa gaya health mein, because no, accounts is only meant for the AGCR and other people. So now the World Health Organization is giving so much importance to the countries by you give a reliable data globally. So now the Ministry of Health and also they have started, at least ours is the only regulatory body to give at least out of the 17 indicators World Health Organization is giving, we were able to give the data to the about 9 to 10. Still we have to capture the data. So therefore, data is a very important. This slide shows where are we. Next. Similarly, another indicator which you can see how the healthcare system which is there operating in the countries, the nurse-physician ratio. This is very important. So again I am telling you, even this nurse-physician ratio is also not a reliable data. But whatever the data with the 1947 to date, what we have between the doctors and the nurses, this gives a very good indication. Still we have to go a long way to reach the international norm to have 3 nurses for 1 physician. So that is the WHO and the international norm. So we have to go a long way to achieve this international norm of the nurse-physician ratio. Next. Coming to the some of the issues and challenges what ailing for the nursing sector, we are not able to do much better. So for the first time, the Honorable Health Minister had with all the regulators. I think first time, at least I worked in the ministry for 30 years. First time I could see sitting with all the regulators in front of the minister, the Medical Council, Nursing Council, the Ayush Council, all the councils sat together. He called it a Chintan Shivar and Heal by India. That is the, I think you will be hearing more often this word. So we had in this Chintan Shivar, I think he was able to capture many of the issues and challenges each sector which is facing. At least the main agenda was, of course, how to attract students overseas to come to India. That is how to send our healthcare professionals outside India. So these are with this 2 themes he started and came out with a lot of the recommendations which are going to come. And definitely a lot of subcommittees he has constituted to study these issues which have been generated in these 2 days in the Chintan Shivar. So at least Indian Nursing Council, before going to the meeting itself, took a policy decision that 25% of the supernumerary seats will be reserved for the overseas students for nursing. So that means we don't want all the nursing educational institutions to admit the overseas institution. Only institutions which are having a medical colleges and the 300 bedded hospitals, only those nursing education institutions attached to those healthcare facility, we will be giving 25% of the supernumerary post for the overseas students for the nursing. So that itself is a big policy decision which has been communicated to the ministry, and it's going to be effective from the coming academic year. With regard to I think again I am telling 67% of the health workforce is nurses. 67%. You can imagine such a huge nursing human resource is available in the healthcare industry. But what priority is given to the nursing sector itself speaks volume of that in the next slides. Next slide. There are no nursing professionals at the policy table, at the state directorate level, or even at the national level. I think after my retirement of 10 years, I think there will still be the 5 nursing positions which are there at the national level not been filled up. So you can imagine if you don't have that's what I remember once I told one of the political representative in Delhi, where I was participating in the lamplighting ceremony. I said, Madam, in the Delhi government, there is no ma-bap for the nursing. So they said, what are you talking? If I write a letter from the Nirman Bhavan to the Delhi government or to the other government, nobody is there to take care of them. You send a proposal for the strengthening of the schools and colleges of nursing, send a proposal for the continuing education for nurses. Because doctor is so busy with the other issues, he may not be able to give the time to send a proposal. So weak nursing organization is at the national level, state level, even at the district level. So that is one of the very important, even the Prasanna Kumar Hota, the then health secretary, we made a due letter to send to all the state health secretaries that strengthen the nursing organization. Because the Prasanna Kumar Hota was the health secretary, was the author of the NHM, National Health Mission. So he realized at that time, he wrote a due letter, but still not been much improvement of having that the nursing organization has not been improved. In many states, people are there, maybe 1 or 2 people, but they are not involved in the policy making. So with the result, somebody else makes a policy to the nursing sector. So therefore, we will be able to sometimes mismatching. The issues or challenges are not being properly addressed. So therefore, the so we have at least one good example, which you can see in slide is in the West Bengal. West Bengal, we have 19 nursing officers are sitting in the directorate, 19 nursing officers sitting in the directorate, taking care of all the issues of the nurses. The commissioner will not sign the file of nursing without the joint director nursing putting the signature. So therefore, their promotions, creation of the posts, the challenges, if you go anybody after the retirement also, the pension paper, if you get into that nursing section in the West Bengal, you will find it. So that type of organization, if it is there, somebody will be there to listen, to address the problem, and when the secretary asks, give the next year planning proposal, so these people will be sit and they will be making the proposals and they will be able to get the more funds. Next. So I spoke more about the staffing norms. It is observed that one nurse is taking care of the 20 to 30 patients, and especially I am talking about the state-run hospitals. At least central government of India, like All India Institute of Medical Science, and at least while I was a nursing advisor, I used to quote in my files 8 central government hospitals. So now those out of the 8 central government hospitals, many have become the autonomous. Like JIPMER, it used to be a part of the central government hospital, it has become an autonomous now. So the 5 or 6 central government hospitals and the AIMS, they have at least reasonably a good nursing staffing norm, which means I want to say good reasonable means it says that SIU norm, SIU means Staff Inspection Unit, attached to the Ministry of Finance. And this Ministry of Finance has given a norms, and they have very clearly said 1:1 for the ICU for each shift. And they have also said 45%. See, one of the issue which in the healthcare is, especially nurses being a large number, you have to give the day offs because they are working in 24 into 7, 365 days. So you Saturday, Sunday, everybody won't get the leave. So you should have a provision to give the 8 day offs in a month. And also EL. So in many of the hospitals, if you get into there, if they say 200 nurses, maybe 50% are working because everybody is on leave or a day off. So this component, that's what state nursing norm is. So at least the central government hospital, since I went to the central government from my state background, so I used to say that this is a luxury for the state government institutions if you are able to get 8 day offs, whereas in the state they don't give the 8 day offs. Even to get 1 day off on a Sunday, it is a luxury. So that type of a working environment is there for nurses. That's for what will be the outcome, what will be the impact. It all depends upon the good working conditions, makes a lot of difference in the impact and outcome of the patient outcomes. Next. The salary. Again, the salary, I think one of the very important, many people, I think my colleague was telling yesterday, why people are going, some of the people who asked the question, I believe, from the audience, that why people are going abroad, I always ask any corporate sector or anybody private hospital when they come to me, Dilip Kumar ji, बहुत attrition rate है, बहुत turnover है. Daily I get 10 to 15 the resignations. I said, sir, अच्छा तनख्वाह दे दीजिए ना, वो नहीं जाएगा. They are not paid good salary. To tell you, our National Professional Association has to go in a public interest litigation case to the Supreme Court. In the Supreme Court, all the state health secretaries were made a respondent and gave a direction to the Ministry of Health, constitute a committee and give the guidelines to the states. See, we have a very good response in India in the healthcare is, health is a state subject. So once by telling, no, हमारा केवट वहीं से शुरू होता है, health is a state subject. अरे, patient is a patient, whether it's a central government or a state government. So they gave a guideline. Ministry of Health constituted Supreme Court guideline. They gave a guideline. For your information, till today, those Supreme Court guideline, salary has not been implemented in the private sector. 75% of the health sector is in the private sector. So with the result, if you are not able to give a reasonable salary, and when our professional association went to the Supreme Court, at that time they gave the paper and all those things, a nurse is being paid 7,000, 8,000, 9,000. Even I think we give very good example. Security staff who is there in this thing, that person is given at least minimum 10 to 12,000. A person who has undergone 4 years of training, and the nursing training is not easy, and a staff nurse cannot sit in a chair. She has to be on toes with the type of the work she is doing in the ward. But where are the salary is? So definitely they have to move for a greener posture, and at least now they are allowing to go abroad. So therefore, the important message I would like to give is that if you are not able to take care of the good salary, definitely the people will go abroad. And the continuing education, there are no periodic continuing education program. When I think health science technology, whatever I trained, it is not relevant now. So the health science technology and the internet explosion is so much in health sector, the protocols are keep on changing day by day. Those protocols, the drugs and everything has to be updated for a nurse if you have to work effectively in the healthcare sector. So therefore, continuing education is very important. There is no money for a continuing education program. Then how they are going to update the knowledge? So that is also one of the issues. And there are no specialist nursing positions. 14 Indian Nursing Council has prepared 14 specialty 1-year post-basic diplomas. Like 1 year in operation theatre nursing, 1 year in cardiothoracic nursing, 1 year in emergency and training, and 1 year in neonatal nursing, 1 year in psychiatric nursing. 14 specialty we prepared. No takers. The reason is, my staff nurse is asking me, sir, मैं 1 साल पढ़ के मेरे को क्या मिलेगा? There is no position. She will not get the salary. So therefore, in one breath we say nurses need to be, NHP, National Health Policy is telling that train nurses in various specialities. That is one prescription. But in practice, there are no positions. I don't know how many people are aware that how literally I worked in with the ministry to come out with a nurse practitioner critical care program, NPCC. I am telling you, with due respect to the medical fraternity who are sitting in this hall, somehow our medical fraternity, when they go abroad, they would like to be very happy to work with the nurse practitioners in UK and USA and all. They are very happy. But when they come to India, they don't want to give the word nurse practitioner. So, with the, again, as a regulator, I was not supposed to go to the Ministry of Health to get the curriculum to be approved. I know this is going to be a problem in India to work as in a team in a healthcare industry, in India especially. So, I took this curriculum to the Ministry of Health. Health Secretary organized a meeting, called the state health secretaries of 3 or 4 people, called the DGs of the 3 or states, had a meeting, approved the nurse practitioner critical care program, and I told, sir, ये nurse practitioner critical care program है, ये बहुत corporate sector में बहुत लोगों का interest है. So our health secretary said, नहीं दिलीप कुमार जी, हम government में शुरू करना चाहिए. So now he made in a minute. I got it minuted. And I wrote so many letters. Ministry of Health wrote so many letters to the states. Still nothing has been done. So that is the level of, I think this minister is taken it very seriously, is now sending some sort of message for creating the nurse practitioner. You know, Honorable Prime Minister has made an announcement that about 53,000 critical care beds are going to be opened after this COVID pandemic. Realized the experience. So where are these critical care beds to be manned by the critical care nurses? So therefore, I think now the priority is coming out to the nurse practitioner critical care. Again, for your information, I am telling, we nurses have been blamed that aapka nurses hai, they are good in theory, not in practical. This has been addressed by the Indian Nursing Council, making this 2-year nurse practitioner critical care program not a classroom teaching. It is a totally residence. 90% of the time they will be in the ICU. No need of going to the classrooms. So that type of a nurse practitioner critical care made it very openly in the title itself, residency format. So that they will not be going and sitting in the classrooms. I want, I think, Rajiv ji, because here you have started the medical college, you might be having so many ICUs, you should start the nurse practitioner critical care program. Because that's going to be a very important for the future. And I think many of the people are telling the best way the ICUs can be run by these, by the nurses, with the critical care nurses. And at least for your information, I happen to be in Maharashtra now. We have very good 2 institutions have done this course, nurse practitioner critical care, MGM Mumbai and the Kharad. These are the 2 institutions have done, and many of the physicians and anesthetists have told me on telephonically, दिलीप कुमार जी ये नर्स प्रैक्टिशनर क्रिटिकल केयर है हमके लिए बहुत हैंडी आ गया कोविड-19 में. So now what is next we are thinking. So we have signed an MOU with the University of Houston, and in for the academic PhD we have in all the not only nursing for all, in practice in abroad they call DNP, Doctor of Nursing Practice, so that they will not get into the teaching. The people who are working in the clinical level, they will only go to the higher level as a DNP. So we have signed an MOU, and the 2 institutions we are going to start on a pilot basis in Maharashtra, that is in Kharad, and the next month we are going to start in the MGM Mumbai, because these doctors who are working there, they have shown a lot of interest and the positiveness and the impact they have seen. So we are going to start on a pilot basis. Next. I think in the nursing education, we all know that the overlapping between the function between the Indian Nursing, the national regulatory body and the state regulatory body, which is one of the hindering process for to take any reforms at the state level and also at the national level. I think this has been addressed. We were, Indian Nursing Council repeatedly was asking the Ministry of Health to amend the Indian Nursing Council Act. Now the whole amendment is going to come in the next parliament. That whole bill is ready. It is called National Nursing and Midwifery Commission. That's called NNMC. And NNMC, once it comes, it is going to address this overlapping function between the state and centers, and a lot of the focus is given for the nursing education, which is going to be addressed. One of the important problem which we have in our Indian Nursing Council Act is the scope of nursing and midwifery practice is not in the Act. So with the result, we have to work on the basis of the institutional protocol. The institution like CMC Vellore says that these are my nurses can do these procedures. So that type of institutional protocols are there. But a regulator, when they go to the court, they may have a lot of problem, legal empowerment. Therefore, we have now in the new National Nursing and Midwifery Commission, the scope of nursing and midwifery practice has been reflected in the Act. Then that commission will be able to come out with a dictatum that, yes, with this type of a training, they will be able to work in the independently. These are the procedures. Next. Next. As I have already said about the nurse registration tracking system, 10.3 lakh nurses with the Aadhaar linked, we have a data with the Aadhaar linked, so that the mobility of the nurses from one state to other state is going to vary. So this NRTS within 48 hours online can give the NOC, so that any nurse coming from Kerala to Delhi, they will be able to effectively get this registered in the Delhi. So again, I have already spoken about the critical care, and the upgrading the schools into colleges of nursing is one of the big, almost Indian Nursing Council has finalized all the reforms, but I think shortly the ministry is going to take a call about the converting all the schools of nursing into college of nursing, so that we have a two category into getting into nursing will be solved with that only graduate nurse. Next. So we have from this academic year, whole syllabus of the BSc nursing we have made into semester system and a competency based curriculum, and we are linking more focusing on the skill labs and the simulation center. So we are now, the ministry also under the NHM is giving a lot of funds to the government institution for developing the skill labs, so that the competency based program can be very effective. And as I said, National Referral Simulation Center, which is again, when I go to many of the corporate hospitals, they say, I have simulators. Where are the simulators? They are under the lock and key, and only for the inspections are there. And sometimes it has become those simulators also individualized. Only that person will be able to manage. So that type of no. If you go and see my National Referral Simulation Center in Delhi, which is the layout, I think Rajiv ji will be able to. And one of the problem what we face in the simulation is until unless if you don't train the teachers, methodology how to integrate simulation into the education, that's not going to successful. Any amount of the money you may spend for the equipment, that's not going to solve. So this prescription has been addressed in this National Referral Simulation Center. Next. I think I have already told all 14 specialties we have made into residency format, so that while working in the clinical setting itself, they can become they can get the specialization. We have also nursing research is one of I was talking to this, I think since MBA healthcare is there in this institution, why can't they address some of the issues of the nursing staff? I was asking some of the friends, why MBA healthcare means the healthcare is more of a 67% is the nurses. Any research has been done on these issues? I think if not there, I think MBA healthcare has to focus more on these issues, so that to come out with the prescription and solutions and policy recommendation to the policymakers. And I think bridging the gap between the nursing and education, I think this is one of our the CMC model. The CMC model, a professor also work in the clinical setting. So that type of a model, now we have got it implemented in the St. John Medical College in Bangalore, and we have put up a concept paper in our INC website. We are promoting that bridging this education service gap, and a teacher who is teaching in the classroom should also work in the clinical setting. so that they will be able to effectively integrate the latest protocols. So that is the one of as soon as I put up in the website next day I got a parliament question. They are asking, has the government of India has taken the decision? So he said, this is a concept note we want to promote, because anything in India, it cannot come out overnight. It requires a lot of the support. Next. See, another leadership for change. I think since the ICN report is telling, we have brought a broad, ICN is doing in 60 countries, leadership for change program by the ICN. We have brought that program to India, and we have trained about 40 people in a 20 cohort each. So now these people are undergoing training. We want to create a master trainers in the leadership, so that they can train the future nursing leaders in India, because this is one of the issue which we have brought into India. The China only last 2 years back they have started. We have brought that concept to India also. Next. Okay, thank you very much. If any questions are there, I don't know whether time permits.
Thank you so much, sir, for such a fruitful session. Your words of encouragement really filled a lot of motivation in the minds of our upcoming Nightingales. Due to paucity of time, we'll have to conclude our session here. I may now request Dr. Sonupan G. Joshi, sir, Director and Professor at SYMHEALTH College of Nursing, to kindly felicitate our guest. May we have a round of applause?